All right, welcome back. Now, still the Good Morning Naija show. And yes, we just finished our newspaper headline review with my brother Ezigu Chukudi. We don't give you the necessary explanation on which I need to do to go out there, go carry paper for yourself so you go feel read them to understand. Yes, we get another better conversation this morning. And based on say today, now World Health Day, yes, this conversation is very necessary. I've been talking earlier. Say everybody need to stay healthy. We need to really, really focus on ourselves and to make sure say we make all these things. We should be all right. Based on not be only one day we will celebrate this matter. It's supposed to be constant lifestyle for us. And the person who will join us here on this matter this morning, now a very special guest, now Dr. Ekute Uchechi Gold, now family medicine resident doctor, Lagos State University Teaching Hospital, Lasut. And we'll discuss this matter this morning. What thing we would like to know? Say, the lifestyle of Nigeria, do we even live a healthy lifestyle? Do Nigerians really take their health seriously? It's not matters what they get. Or we won't do them, or the opportunity or the necessary health care not the to cover up. Well, make we welcome our guest this morning. Madam, welcome to the show. Hello? You hear me?
Hello, you can hear me. I can't hear you.
I can hear you loud and clear. Can you hear me?
I can't hear you. I'm really finding it difficult to hear you.
Okay. So is it low or you can't hear me at all?
It's quite low. It's quite low.
Okay, let us try and call you back again. Maybe we can reconnect.
Sorry?
We'll probably cut the call and we can call you again so that you will probably reconnect well. How about that? Okay, so make we try connect and back. Like say she could need to hear us clearly because this conversation is very necessary. Make we even understand these whole levels. What we need to know as Nigerians, our health, regarding our health. So some people they talk say health is expensive, so they know they even think about them too much. They say poor man know they get good health care because money no dey their pocket. And a lot of these excuses they why some people know they live a healthy lifestyle. So yes, we will discuss this matter this morning with a doctor, and she go there with us over the phone. We will talk to her over the phone so that we will feel here and clearly because our Skype not to connect them easier. So we'll try a phone call so that it go clear, so that we will fit hear everything as it's supposed to be. Make we not miss any part of the conversation this morning. So everybody when they watch me, make una carry pen, carry your paper. Time don't reach where you go jot down some things. Our doctor don't dey here and we'll go ask her some very, very necessary questions where you go need as person where one day healthy. Yes, some kind of things where you need to stop. Some kind of places where you things where you do where you need to stop. Because if you don't stop them, you can't be like say with a pour water inside basket, you know go hold. You understand? So yes, our doctor go follow us talk this matter. Uchechi Gold, and a family medicine resident doctor for Lagos State University Teaching Hospital, Lasut. So I don't know whether we don't connect back to her, whether she don't be on the line. Make we yarn this matter as it be this morning. So okay, Madam Gold, you don't join us back. Hello, Madam Gold.
Hello, can you hear me, sir?
I can hear you loud and clear, madam. Can you hear me?
Yes, it's just a little faint, but I can hear you.
All right, madam. Moku just they try, they push them, they go like that, small, small. All right, so Moku they try, they push them like that, they go small, small. So, madam, thank you as you join us this morning. We want to talk about this, based on say today in our World Health Day, Nigerians as it be. So, sure you believe, you want to talk to Nigerians, they take care of their health. Make we start from there. Are we really, really concerned about our health?
Okay, so if I get you, your question is, are we as Nigerians concerned about our health?
Yes, do we really take it seriously?
Oh, okay. Okay, from my experience, what I see is most Nigerians, we don't have what we call good health seeking practice.
Okay.
So when people fall ill, they first of all go to try to heal themselves. Right, so people would go to the labs, private labs, and run some tests. Some might do herbal mixtures. Some might try the traditional methods. And when all fails, you see them reporting to the hospital worse than when they first came, when the illness first started.
Yeah.
Okay, and at that point, it might just be all the doctors have to do is just to try to manage the situation. Depending on what the illness is. So if someone falls ill, your best bet is go straight to the hospital and hear from your doctor. I see most patients who tell me, I had these symptoms and my friend told me to take this medicine because this is what the doctor gave him or her. It's not a one-size-fits-all thing for people.
Yeah.
So the fact that you're having the same symptoms as someone doesn't necessarily mean that people might be having the same illness, and it might not be the same medication that will work for him or her that would also work for you. So we have to try to have what is called a good health taking practice. Go to the hospital and hear from your doctor when you feel you're ill.
Madam, this thing we don't talk, so it makes sense, God, because I've been able to talk and say, a lot of people they talk saying, my friend tell me, make I take the drug, because now the same headache can get, now I myself I get. But a lot of other conversations, they talk say, their own side of the story, be say, it quite expensive to go see doctor. So they could just rather branch, go one guy where they do one mixture, where they could just take. So don't you feel so that this is a situation that we should also look at? It is quite expensive for the common man to go to see the doctor. What do you feel about this one? What do you feel say we feel do to change that thing?
Hello?
Yeah, madam, you hear me?
I didn't hear the last question, sir.
Okay, I said the question is that you've been talking saying make people they go see doctor first if they feel anyhow. I can't talk say, but people they talk say it is quite expensive to go and see a doctor. So that's why they resort to the other the people around to just give them small thing to take cure their illness. What can we do to salvage that situation? As a matter take be, money is a big issue to some people. What do you feel about that one?
Okay, yes, the truth is out-of-pocket expenditure in hospitals, yes, they can be expensive. But then there are primary health care centers, okay, where people can access care. So if you fall ill, that little money you want to go and give someone by the side, why not go to the hospital? The truth is some people's illness, all they need is just advice and lifestyle changes. All right, if they come in at that time when it first starts, can you hear me?
Yes, I can hear you. Go ahead. Go ahead. We hear you.
If they come in at that time when it first starts, okay, it's possible that all they need is just a lifestyle change and then they will get better. But it's all about awareness. Most people don't know that they can actually walk into a primary health care center. The cost of care in a primary health care center is different from a private hospital. So you can't walk into a big private hospital and expect that you will get the same amount if you enter a government primary health care center. Now, there are so many primary health care centers. There's always a doctor there. There are nurses there. So all you have to do is walk in and tell them exactly how you feel. If you go to treat an illness earlier when it starts, it's cheaper to do that than when it's worse off.
True stuff. Madam, so it good as you don't point out that one, say we get different health centers where you go fit administer to people, even if they don't get too much money. Now, make I carry and go this other angle where some other people they talk. Say sometimes they feel shy or ashamed they catch them to carry the illness where they feel go meet go some kind of hospital because they feel say the way they will come they treat them it not go good. You feel say have you ever witnessed a situation like this before where the patient no one tell you the cocoa of the thing where they worry and because they feel some type of way they feel say you go look at one kind. Should this thing don't ever happen before?
Yes, it actually happened. A lot of people feel shame or they feel like they'll be stigmatized because of their illness and all. But when people stigmatize others, it's due to lack of awareness. Okay. Most of them are not educated about what is going on. A doctor would not stigmatize a patient for an illness because the doctor understands the concept of what is happening to this patient. I've seen patients who walk into the hospital and they want to whisper what is going on. So the next person beside wouldn't hear. Yes. And then you have to, of course, confidentiality. You have to try to ensure that just you and your patient. And then you tell the patient, say, you can't lie to your doctor. If you don't tell the doctor the truth, you cannot get your full care. Okay. So it's all about awareness. If people are aware, they would not stigmatize others, and people won't feel so shameful about expressing how they feel to their doctor. I think most times what prevents people from coming to the hospitals is the stigmatization others give them and not from the healthcare workers. Okay, they are just ashamed to talk about it. So most people just have to be aware that they have to get treatment. We have a whole lot of cases. And those who overcome this shame, this stigmatization, and come to the hospital, you actually see them looking much healthier than even those who seem not to have any illness, as long as they are on the course of treatment.
Yeah. All right, Madam Go, this conversation we don't get this morning makes sense. I don't carry some kind points so you give. You talk, say, make people not be one drug fits all. Make that they go hospital, go check for themselves. You also talk, say, make shame not they. Go hospital. Tell them as they be because that's not the only way you go feel get your healing. And I beg, make you know the fear say it's too expensive. She talk and say some kind places they for hospitals they we go feel help you treat your ailments without too much money where you go pay. And Madam Uchechi Gold, now I just speak with just now medicine resident doctor for Lagos State University Teaching Hospital, Lasut. Madam Gold, thank you very much. Have a beautiful day.
Thank you so much.
All right.